Officially begin.
Sounds good. Well, thanks for having me. I know today we're talking about the OFA respiratory function grading and BOAS in Frenchies and how we can work to improve the airway syndrome in Frenchies since it is a very common thing. I'm based in North Carolina. I was talking with Jess because we were talking about some of the having a respiratory function grading um, clinic at some of the dog shows on the East Coast, and that's how we got connected. And then I kind of routinely do some of these talks for breed clubs because I know y'all y'all know what you're doing, and sometimes it's just helpful to have some support. So along those lines, and I know with the group here, but I know when it gets shared with the big Frenchie club, there is no such thing as a perfect dog, and I am very clear about that. So when I'm talking about obstructive airway syndrome in Frenchies, I'm not being critical of Frenchies. I love Frenchies very much. But it's knowing it's information is power and helps us improve. So I think there's a lot to be said for the vulnerability to acknowledge that there's a problem and to be looking for the problem and finding solutions. And so I never want any of these talks or the things that I talk about to ever be taken in a like critical way. It's just an information way so that we can do better. I know you guys already touched on the breeding to improve over the summer, which I love, because at the end of the day, we want puppies, but we want healthy puppies, and that's the biggest thing that we're working to do. So today we're going to talk about brachycephalic obstructive airway syndrome, which I will pretty much call BOAS from here on out because I'm not going to say the full thing. We'll talk about the OFA respiratory function grading, like what the test entails, and then interpreting and applying the results. And then we'll talk little bit about finding a veterinarian who's certified. This test has been in England for over a decade, but has only really been in the US for the past 2 years. And so we're still kind of working our way through. So let's talk about BOAS overall. Sorry, Heather, you unmuted. Did you have a question?
Yeah, I was going to ask you if you knew Dr. Ladlow.
The name's familiar, but I don't know off the top of my head.
Yeah, she's the doctor that developed the test and the grading system for
Yes,
Cambridge, and
yes.
she's an honorary member of our foundation.
I love
We're
that.
super excited to have her. So when you mentioned England and everything, I know she's very on board with helping us
Yes.
uh, get the momentum
Yeah.
behind this movement. So,
And
yeah.
some of the videos that I'll be using here in a little bit are some of the videos that she put together for the certification process. So it's been really great, the resources that she's been able to pull to help make this feasible in the US.
Yeah.
That's awesome
Yeah.
that she's part of the group.
Thanks.
So when we talk about BOAS, I always lovingly say that Frenchies are athletes. They are couch potatoes, but also when it comes to breathing, honestly, they are athletes. So when I think about like your non-smushed faced breeds, I think about a runner on a track. And then when you add in the brachycephalic aspect, the smushed faced aspect, they are like hurdlers. So if you put a hurdler on the same track as someone without hurdles, who's going to get to the finish line faster? And yes, part of that may depend on the athlete, but for general purposes, we're talking about from getting from A to B. And so when we talk about breathing in general, it's air outside to air inside in the lungs. And for Frenchies, and all brachycephalic breeds, there are a number of hurdles along the way. And so we're going to kind of talk about the hurdles so that everybody knows what we're talking about, and then we'll go into scoring from there. So we start with the several different problems in Frenchies and in our smushed face. So first is stenotic or narrow nostrils, an elongated soft palate, an enlarged tongue, which has a fancy term. But if you look at this diagram, so you've got like the golden up top, right? And then you've got a Frenchie on the bottom. Proportionally, the size of that tongue compared to the golden's tongue is dramatically larger. And again, everything's just space occupying. That's just the whole theme of everything we're talking about. Um, Aberrant or abnormal nasal turbinates, everted laryngeal saccules, and then a hypoplastic trachea. So again, I'll go through all that. I know it's a lot of fancy terms, but basically each thing is a hurdle along the way is the theme. And each hurdle leads to inflammation and swelling, which further exacerbates the hurdles and can become a progressive syndrome with time. So that's why one of the things we'll talk about is testing is acknowledged when a dog's a year old, but because it's a progressive syndrome, some dogs could change as they get older because of secondary things. I add obesity to this list because our brachycephalic dogs tend to store their excess weight in their neck, which can further kind of obstruct everything that's going on. And so we'll talk later with scoring, but sometimes weight loss can actually improve scores. But I count weight, even though it's not an immediate on the immediate short list, it does play a role. So when we talk about our nostrils, we have basically it's we're talking about the size of the airflow. So this dog here is comparatively wide open compared to this little, I lovingly call them piggy slits on my patients, where they just have this tiny little slit. And even though it may not look like a dramatic change between like mild, moderate, severe, it actually has a like basically to the fourth power impact. I'm not getting into physics. None of us want that on a Tuesday night, but basically a small change one way or another has a really, really big impact in terms of how much air gets through. So this is roadblock number one. When I put through so what I try to show in that video is that it's not just the outside that's blocked and then it's open on the inside. It's the whole tunnel is narrowed. And so you can see how much tissue they pulled out when they were expanding that nostril. It has more of an impact than just the little slit on the outside. So we work our way in, and we're going to come back to this image on the left here a couple of times, but the next hurdle on the way, or one of the I ranked by priority, not location, but is the elongated soft palate. So this is the back of a dog's throat. So you've got this epiglottis, which is this flap that covers the trachea. So when we're eating, people and pets, this flap goes up to cover the windpipe so that food goes in the esophagus, which sits up here. So when we intubate a pet, like for a C-section or something, this is where we're putting the tube. And you've got the vocal cords here. So when you're looking in the back of a dog's throat, which they're almost guaranteed to be at least sedated for because no dog's going to sit still for that. But this is what it should look like for most of our pets. So in our brachycephalic pets, so you can see that almost there's like a curtain that covers that area. And so again, just another hurdle that the air can't get straight through. It has to go kind of under and around. It just adds another layer. We've already touched a little bit. Yeah, go ahead.
For that video with the curtain, what would that dog's BOAS rating have been? Would in your opinion?
At
Three?
least a two, potentially a three.
Okay.
We'll go through some of the scoring, but I would imagine it would
Yeah,
show
because
up
that
with
looked really bad.
it did. Sadly, that's actually not the worst one that I've seen. But yes, it was significant. And obviously, for demoing purposes with showing things, it's easier to see more dramatic things from a learning perspective
Sure.
because seeing a minor one is harder to see. So they're not always that severe. But yes, that totally is within the realm of normal. So along those lines, I know we touched a little bit about the big tongue.
I think I would freak out if my dogs had that long of a tongue.
Keisha, were you saying that your dogs have that?
No, I would freak out if my dogs had that long of a tongue. Like that looks
Oh, yes. Also, the way he says it is
crazy.
weird. Yes, but it's the best video I could get of that. So that soft palate was probably the size of like my thumb. Now, granted, I have small hands, but I would say probably like two M&Ms side by side is what that flap was that they removed. And that's a big curtain when you're talking about that flap that's there. So just kind of helping to see that. So those are the big ones that people think about when they talk about BOAS, but there are a couple of smaller ones as well. So aberrant nasal turbinates, that basically just means like abnormal or irregular. So there are these bony pathways in the nostril so that when air comes in, it gets filtered. I don't know about y'all, but there's like an insane amount of pollen outside right now. And that's how your airways are able to kind of filter out some of that. And so it should basically be like a normal pathway, but just with a little bit of filtration. But in a lot of these dogs, and you can see better here, so this would be like, I go to as a golden just because the initial photo was a golden, but your normal snouted dogs are going to have a decently open area just with a little bit of that bony protrusion for filtration. And as you go in a little bit deeper, there's going to be a little bit, but you can see all of this black area is where air can go through. So you've got a pretty open tunnel. This is some of our brachycephalic breeds. So you can see early on, you've already got more stuff in the way, but as you get closer, as opposed to this big open maze, this is like the super hay maze that people pay extra for at Halloween because you can't really get through, right? And so when we look at that on a scope, you should have these big open tunnels, but you've got bony protrusion in the way. So again, you've got the air at the beginning of the nostril that gets in the way. Then you've got the bone that gets in the way. Then you have the soft palate that gets in the way. Um, and then you can have the laryngeal saccules that get in the way. So these in that diagram of the throat that we looked at earlier, this is basically like a rug that's up against the wall. So you can see the airway there. Do you see this area here? When the dog breathes, it almost fully comes up. So you can imagine if you have, what's a reverse curtain? I don't know, a rug. But like a rug that gets pushed up against the wall, you've got something there, you've got soft palate down. This open tube of the airway gets blocked pretty quickly. And you can have a lot of swelling in these other tissues. So in addition to having it being closed off above and below, you also have it side to side.
It's like wall-to-wall carpet.
Yes. No one likes a 70s house layout from like the old
Shag.
carpet. Yeah, exactly. And that's sort of what we're looking at. So again, it's just hurdle after hurdle. And that's why I jokingly, but don't jokingly say these dogs are athletes because it takes a lot of work for some of these dogs to breathe when they're severely affected.
Mhm.
And it's just kind of a perfect storm that builds up.
Do those tissues swell like from like a histamine reaction? Like if you're having a an allergic reaction to the pollens and such, can they swell up even more too? Just like
Mhm. So
people,
this tissue here is actually tonsil tissue. So just like with
right?
us, I mean, they don't tend to have tonsil issues the way people do, but that tissue can swell during certain times because those do have like immunological function. And then the tissue overall, when it's irritated, because it's, as you can imagine, all this just gets inflamed, then it gets thickened that way as well. So it just kind of all keeps building up. And then the last hurdle on the way is the hypoplastic trachea. So, you've made it down the nostril through the back of the throat here. And then if a normal diameter windpipe is here, some of these dogs can have a narrowed windpipe. And so again, it's just kind of hurdle after hurdle to get to the finish line of air in the lungs. So when we're talking about these syndromes, when we're going through this list of things, some of these we can see. Like, okay, I can see what the dog's nostril conformation is. but I can't tell what's in their nose or, what's going on in the back of their throat without sedation, a CT, potentially anesthesia, potentially scoping, which is not practical from a testing standpoint, to ask breeders to CT every single dog in their kennel. Let's talk about practicality. The other thing is, if there are breathing risks, then that's not going to help, right? Like that's just going to put the pet at risk for what benefit? So this dog actually came in last week. This is a video from in our hospital. He was very sweet. He was here for a nail trim. You can see him. He's got a little bit of narrowing with his nostrils. They're actually, I would say, mild, but he's got some other things. His tongue's huge. You'll hear his soft palate in a minute, and he is a little bit chunky, which goes hand in hand.
I can't hear it. Can anyone else hear it? Sorry. No, no
Could you,
sound.
have you guys been able to hear the other videos?
E no.
No.
No,
Okay.
but I can imagine, I can feel him
Yeah.
breathing.
Okay.
You can
Good.
see it. He's heaving, you know.
Yeah. Okay. Um, some of the videos at the end, the sound does matter most, but I'll make sure that I get the links sent out so that everybody can still listen, as well.
Yeah. Okay.
So this dog, the reason I included him is because he is obviously like a severe case of BOAS, but also, so he was just here for a nail trim, but, we couldn't, um, he was getting worked up, and because he couldn't really breathe, if he stopped to lick cheese, he actually turned blue. So, we set him on his way with some anxiety meds and was like, let's try again next week. And actually, he did really well on Monday, but just he can't breathe and eat at the same time. And again, I'm not being critical of Frenchies or other brachycephalics. It's just this is
It's
what we're up against and why we care and why we're testing.
it's scary because, if you've ever seen a dog, and I've seen it, I always travel to the dog shows with lemon juice because,
Yeah.
and you know, it hasn't happened to my dogs, but I've been there and I've assisted and then they throw up and they've got the foam, and it's so scary.
Yep.
So it's not a hate thing. It's an observation, and I think the reason we're all on board for this is, it's the number one priority. If you can't breathe,
Yeah.
what are you doing?
Right. Right. I mean, you're absolutely right. And it's not necessarily a simple fix, but at least we have something that can correlate and start getting us in the right direction, which is fantastic. We've had dogs that will pass out, during a nail trim just because they can't breathe, they get worked themselves up, and then we're having to like intubate. So we have several pets that are flagged that like they cannot have nail trim without meds because it's just too high risk for them. And again, those are obviously like the more extreme cases, but we're just trying to skew the genetics back the other direction, to, like you said, what you're prioritizing is going to get better, right? And, because we haven't had a way to fully prioritize it well, it's not always been a feasible focus, but the testing does make this a lot easier now.
Yeah, and I don't want to interrupt you too much, but I think so often I've heard, oh, this is common. It's part of the breed. And oh, just get the surgery and it'll be fine. And then they breed dogs that have had to have the surgery just to live.
Yeah.
And it's hereditary. It's clearly hereditary. So,
Yes.
I think that's where the mentality needs to get changed. And I'll let you go on because I know
And
you've got
the
slides
and the
for that.
other thing that I've seen too is we've had several Frenchie breeders that don't want to test because they don't
You
want
don't
to
want to
know.
know.
And I
Plausible
understand
deniability.
that. Like I understand that it can be scary to be vulnerable in that position. But at the same time, it's a huge sign of strength to put yourself out there and say, okay, let's learn what we can do to improve and let's start working that way. But I understand where those clients are coming from. I mean, obviously, I'm a huge proponent of testing, but I do understand that you're right. Like a lot of people, it is the way that it is, or I just don't want to know. But neither of those options are going to work in the long run. So let's talk about testing itself. So the testing system is actually relatively easy. The nice thing is because it's not practical to CT every dog, it's not practical to do like any of those things, and it's too much risk. This system correlates really strongly with the extent of BOAS that the dog has. So it doesn't necessarily mean that we know, the length of the soft palate versus whether it's the nasal turbinates or like what components, but we at least know what the overall picture is without having to do invasive testing. The test is currently approved for pugs, Frenchies, and Bulldogs. Other breeds can do it, but it's not technically recognized by OFA. Hopefully, more breeds will be studied for it. We're just not there yet. The minimum age is 12 months. You can do younger, but it's a prelim. And they recommend for several of these, and we'll go through testing again at 2 because it is a progressive condition. And so while they could be a lower grade at 12 months, they could be a higher grade by 2. And so it's something where we do monitor. We also use it at our hospital to help assess risk, like if we are doing a surgical repair, to help us know what we're getting into and what's reasonable. If it's a severe grade 3, then we may say you're probably going to need more work that then can be done here, and you should probably be, at a 24/7 ER versus like a grade 1 or 2. We can see improvement that way. There are a few basic questions. It's basically, does your dog pass out? But there are a few basic questions that we ask first. The vet will do an exam of the dog at rest. We'll get them trotting for 3 minutes. It's a big, like we try to get them moving. And then we listen to them immediately after that to see what sounds that we're hearing. The caveat with the 3 minutes is if it is a dog that has a history of syncope or going cyanotic, we're not going to make them run. And if they are, it needs to be in an air conditioned room. I know Jess kind of touched on that earlier. But we all know, when it's 90 degrees outside, everything's harder. And so that can skew the results a little bit. So we try to have it in a climate controlled area, but get them up to a brisk pace. The 4 things that we're looking at are nares or nostril conformation, which I'll come back to, respiratory noise, inspiratory effort, and like abnormal breathing. And then if they go cyanotic or have a fainting spell, which is what syncope is, obviously that's only in your severe cases, but that's something we're looking for. One thing that I always touch on is that while we have to document the nostril conformation, it doesn't actually have any bearing on the score. So a lot of clients, when we do this testing, will understandably get defensive that, it's not really mild, or it's not really moderate, it's mild, or, whatever it is. But at the end of the day, it doesn't factor into the scoring at all. So it's not necessarily worth your mental concern either. But I totally understand where people are coming from. We just document it. It doesn't actually count towards scoring.
I think that's a really good point because a lot of people feel like this test is judging the phenotype, the way it
Right.
looks.
Right.
And I was not aware of that. So I think that's something going forward that I will share with people, that even though it's documented, it doesn't impact the score.
Yeah.
And the reason
And
I say that is
honestly,
we know there's a lot of dogs that don't have the most beautiful nose on the outside, but everything else is right on the inside, and they
correct.
get enough
Correct.
to do the
Yeah,
job. So
you're
thank
spot
you.
on. Yeah, of course. The other thing that that I always point out with that too is like not only does it not factor in, I don't even know if it counts on the OFA website, because usually the OFA like chick database will just have the final score. So I don't even know that it's visible necessarily to people for it being on there. I think typically they just will have like RFG and then like grade 2. So
Yeah.
even though it's documented, it's not even necessarily visibly documented.
Only if they share their certificate. It's kind of like the spine, the spine is well, it's a little different. How about hips? If you do prelim hips, but you didn't authorize for them to be visible, whether they were normal or not, they don't show up on the database, but you can share your certificate. The same, I
Right.
have the BOAS certs as well, and
But does it document the nares conformation?
sure does, yeah. And
Okay.
actually, the
I
dog
didn't
I
I
have
didn't
is
know
a
if it
0.
just had the grading, like grade 3 or grade 2 or like whatever, or if it also
I
said.
think I'll look for it, but I think the piece of paper I received, it shows what the nares were, and mine was mildly stenotic,
Mhm.
and then but he was a 0, almost a 0-0, but they gave him a 0-1.
Okay.
Fine,
I,
still great. I'm happy with that
I
at
think
this
that's
point.
you're probably talking about the form that the vet is filling out though, Heather, right?
So two,
I'm
one's the
looking
form
at
they
my,
fill out, and one's the cert that they give you, and then there's the
yeah,
one that
I'm
shows
looking at
up on
my
the
cert that
database.
I just got today for Etta.
Ah, okay,
And it doesn't say anything about the nares on her cert. It just says that she has a grade of 0 and is
okay,
clinically unaffected.
Yeah.
And if I look her up in the OFA database, it just says grade 0.
right. So
So
it's just the
I
form from
think
the vet
like,
then.
yeah, the form from the vet that we see on our side is what would say it, but I don't think anyone else can
Mhm.
see.
Yeah. Which is at least nice if that is, I
Yeah,
don't
if it's
like
a
to use the
concern
word
that's deterring
security, but
somebody
yeah, like a
from doing this,
concern. Exactly.
Yeah.
Like it's
mhm,
not even necessarily super visible because at the end of the day, they're just looking at the final
like,
score.
don't judge my nose.
Yeah.
Don't shame my nose.
So when we look at respiratory noise, and I wish that this would play the videos, but again, I can send out the links so that you can play the different parts. But what we're looking at is basically, can we hear the noise with at just listening with a stethoscope or sort of intermittently a mix? So some dogs you won't hear at all. Some dogs you'll only hear if you listen to their throat. And then some dogs, like you can just be standing there. Well, you can be standing 2 rooms over and still hear them, right? And so that's the next component. The two parts of this, which I know probably won't play the best. So stertor is like a snoring noise. So they'll, if they're not asleep, but they're snoring. And then the other, oops, you guys still can't hear it though, I don't think, right? That's super annoying. Even if I turn it up all the way, I take it that's a no. Okay. It was worth a shot.
No.
Um, sorry,
I
gotta
can
love.
I can try and simulate the sound for you, but it gags me every time.
I debated it and then was like, I think I have a little bit more self-respect than that, so I'll just describe it. But I do respect your effort. Thank you. The other is stridor, which is just, it's almost like a higher pitched wheezing. So both of them are noises that we hear with obstructive airway disease. They just come from either upper or lower airway that we're hearing. So basically, we're listening for snoring and wheezing that we can fully hear or that we can hear with the stethoscope. The next thing that we look at is how much effort it takes to breathe. So are they just breathing or are they having to work to inhale? Because the curtain, okay, if you think about the curtain over the windpipe, right? It's when you inhale that the curtain gets sucked in. But when you exhale, the curtain blows back out. So it's not the exhale that requires the effort, it's the inhale that requires the effort. So it's during those areas of breathing that we may see like increased effort or muscle movement. This dog you probably can't hear, obviously, but you can see how much effort with the muscle here um, that it's taking to breathe from that standpoint. And then the last one, which I had to laugh, you cannot find a picture of a cyanotic Frenchie online, which I think is probably a good thing because that means that if it did go cyanotic, somebody was stopping and intervening and not just like, let me grab a video. But at the same time, they will literally turn that purple color. So like that dog that I showed initially with the pizza collar, he will turn like a purple blue during a nail trimmer when he's stressed. So the scoring sheet, so again, it will ask about nostrils, but it doesn't actually fully factor in. So you just put the level of stenosis. You'll put the respiratory effort, whether it was normal, whether there was some effort, or whether dyspnea is a fancy term for abnormal breathing. What noises you heard and what extent, the effort that it took to breathe, and then if it passed out or not, which hopefully it did not. And then based on the scoring system, it gets either a 0, which is normal, or a 3, which is severe, or anywhere kind of on that spectrum. So your grade 3s, I mean, your grade 2s are your easy ones because they are healthy, you don't hear anything. Even when you're listening with the stethoscope, everything is normal. If they are normal at 12 months, because it is progressive, it's recommended to repeat at 2. I don't think it's required by OFA, and I don't think it's required by the breed club, but the recommendation is to follow up at 2 and just confirm. I'm a fan of testing at all. So this is not a hill I'm going to die on with my clients because I'm just trying to get testing in the first place. But in theory, the recommendation is to repeat testing at 2. It's really easy because you don't hear anything. There's no effort to breathe and there's nothing scary. So these are your, we'll end up calling them the Swiss Army knives of the kennel because everything is beautiful and they are pretty low grade. You're not going to be able to hear this video, but the good news is there's no sound in the first place. But when they're breathing, you can see it's not taking any effort to breathe. It's not, we're not having to do a ton. The nice thing with this video, which I'll send out, is it does have the what the throat sounds like, which again, right now currently has no noise, but you can kind of hear from that standpoint. We've got a little bit of panting, but we settle in pretty quickly. He's got his mouth closed for part of that. So these are the dogs that are not affected at all. Mm-hmm. When we go to our grade 1, we have, oh, sorry, Heather, what's up?
Oh, no.
Oh, no, that's okay. Sorry, I just saw you were unmuted. When you have your grade 1, so these are your dogs that are unaffected. So clinically, they're doing great. But they may have some respiratory signs. We may hear some mild noise only with the stethoscope. We're not going to hear anything just standing there. But it doesn't affect exercise. It doesn't affect their ability to live their life. Again, it's recommended to repeat it 2 to make sure that they are truly a 1. But these dogs, it's very minimal noise that you'll hear. So when we're looking, again, no effort, nothing scary. We may hear some mild noise, especially like after they have their exercise. So ET is exercise test. After that, we may hear a little bit. But overall, standing next to them, you wouldn't know anything's going on. I'm not going to play the video because unfortunately it's not going to work. Your grade 2s. So the good thing is, in my experience, very few dogs are your like full grade 3. A lot of dogs fit into like the 1 or 2 category. But 2s are where you start being clinically affected. I could hear the dog if it's in the room, but it's able to, but it's not severe, if that makes sense. The interesting thing here is that it says the dog has clinically relevant respiratory signs and requires management, including weight loss and or surgical intervention. So some of these dogs, because we know this is where the obesity bullet point on the first bit is coming back now, because we know that obesity contributes to or exacerbates BOAS. If you have a grade 2 dog and it's overweight, if you have them lose weight and retest, sometimes they can drop down to a grade 1. So these are dogs where we may start small. I mean, obviously, if we're having to do surgery, that's a different component from breathing because I'm not just going to retest because it had surgery. But if we can get it to lose weight and have it drop down, then that is a really nice option. So those dogs, I'd normally put on a diet and retest and see where we go from there. We can hear them, but they are overall, they're not your severe cases. You may have mild noise. You may have, it may get a little bit worse after exercise, especially being a little bit abnormal with their breathing. They start off not really having a ton of effort, but it may be pretty significant after exercise. Um, I always talk about like regurgitation with my clients. The difference between vomiting and regurgitation is that vomiting comes from the stomach. And so it's that classic, like you're asleep and your dog starts to vomit, you hear it coming and you're going to wake up. Regurgitation is your dog's just standing there and just goes, "Wah," and it just falls out. And that's really common that we'll get that like foam or saliva when they're having difficulty getting that oxygen in. They may have that regurg. So those are all things that we're looking for with the grade twos. And then our grade threes are your severely affected dogs. You can hear them. They are really struggling. The recommendation is that a grade three dog should not be bred and they should be treated. Again, it's not when people are concerned about doing testing, which I understand, it's because everyone's worried that their dogs are all gonna come up grade threes, right? And honestly, more dogs come up one and two than they do threes. So even what we've had a English Bulldog breeder who was part of our certification process, and we've always thought of her dogs like we were sort of statistically thinking it would be a high percentage of grade threes. And even that kennel was much more ones and twos when it came down to it, which is a good thing. So these are your severe cases. These are your ones where they are going to have severe noise. They are going to have effort breathing. They're going to be dyspneic from the beginning. Again, we may not even do an exercise test on these dogs if they have a history of passing out. We're not going to make them run. But these are your cases. And if there is a history of the dog going cyanotic or having a fainting spell, then it is just automatically a grade three without the whole exercise test or not, because we just know the severity of that automatically puts it in that standpoint.
Can I ask you a question about the grade threes that you interact with? And,
Yeah.
and I'm going to say this. I know that the BOAS for French Bulldogs is fairly new. I was at the first, Amanda and I both were at the very first clinic where they rolled it out in Portland, Oregon for Frenchies. I was in 2021, I think. So for the dogs that are a three, even though there's not that many dogs that have ever been, Frenchies that have been tested. Wow, this light was really, that's what this is for. There you go. Now you can see me. For the dogs that do get tested, the very few that have been done, I would think that most of those are people that kind of assume their dog had a fighting chance to pass with under a grade two, you know. But for the grade threes, based on what they're defined as and what gets them there, you probably already know that your dog doesn't breathe clear.
Mhm.
You can
Mhm.
hear them, and
Mhm.
you don't need to have the stethoscope to decide. Like it's obvious, right?
Correct.
So for
Yeah,
those people that know that, they're probably not even taking their dogs in for the assessment.
correct. And so when we have clients do the testing, very few of them are grade threes because you're right, they probably catch it beforehand. The other thing is if we have a three, a lot of times it's a pet, it's not a breeding pet, it's a pet that's there. And they're planning to neuter, and we're trying to help them understand that all the noises we hear mean, please let us resect your dog's soft palate. Like we have other things. So a lot of times it's our way to have a standardized like information of this is a problem for people like you said earlier, where they're like, well, that's just Frenchy noises, and so that's our objective way to say, no, we're not being critical, but like your Frenchie really does have these problems, so please let us fix it. You're right. From a breeding standpoint, we get very few grade threes because the people with grade threes either catch it before they come in, don't want to test because they know what we're going to say, or just are already putting them in pet homes.
Yeah. Or there really aren't that many evaluators available anyway. So if you
Yeah,
can't find somebody to evaluate,
that
you
too.
you kind of get off the hook. You don't plausible deniability. Also, when you were talking about the obesity, um, there's the kind that comes from food, but there's also the weight change that happens with a pregnant female. And I know for when I was pregnant, towards the very end, everything pushing up on me, it was harder to breathe. And so I also want to, I don't know, I don't even know what I want to say about it, but the fact that we as breeders, we should be very concerned about the females that we're putting into that situation where they will have an increased weight and stress on their organs and systems. And if this is all messed up too, talk about obstacles and challenges.
Yeah. You're absolutely right. I mean, when I have, a bitch come in for progesterone and like a pre-breeding consult on the front end, I especially care in a brachycephalic dog if they're overweight or obese. I mean, I care in all breeding dogs, but especially them because I'm like, it is going to physically be much harder on them for their pregnancy. It's going to put them at higher risk. Like, as much as I understand what I'm asking and that it sucks, let's skip a cycle, but spend the next 6 months getting your dog down to a fighting weight, where they're healthier, they've got more ability to move, they're in a better position to be able to carry on that pregnancy without it taking the toll that it does. And then let's reevaluate. We'll have better pregnancy outcomes. It'll be safer for mom, and she'll be a lot less miserable. So you're absolutely right. I mean, pregnancy weight, what we're asking them to do, Frenchies are athletes, right? What we're asking them to do and take on, especially with the obstacles they have, it just all exacerbates.
I had a quick question.
Yeah.
How does this reflect on dogs that might be like anxious when they come into your office?
Mhm.
Because I know my friend who doesn't have a French bulldog, I think she has some kind of a lab mix. Her dog gets so worked up, like you would think it was an English bulldog with
Mhm.
BOAS,
Mhm.
because she just, as soon as she gets into the vet office, it's like she does like the regurg and the heavy panting, and she turns bright red. And
Yep.
Dramatic.
So
so if you have dogs like that, how can you accurately score those dogs?
great question. So what we're listening for are very specific noises, and we're listening to the airway itself. So like if they regurged, but they weren't having the noises, or they weren't like, that can just happen, right? It's all bigger picture. So even when a dog is very stressed and is panting heavily and is having a hard time, and I try really hard not to be stressful, but I get that coming to the vet can sometimes be a stressful experience for pets. Um, the panting and noises still shouldn't reverberate in the throat. So the sounds that we're listening to, that wheezing, that snoring, we shouldn't be hearing that. We might hear like rapid breathing, but it should be
Yeah.
normal breaths. And so the only time that we're hearing the snoring and wheezing is if there's obstructive airway disease. Um, so, which regardless of breathing rate, all that, like if there's no elongated palate, we're going to hear it versus if they're normal, but they're just panting, we're not going to hear that same noise. So it doesn't tend to interfere to that extent. Again, while I would love them not to regurge when they're in the hospital for their own sake, if I'm not hearing any noises and they regurged, I'm not going to automatically like fault that,
Yeah.
right? And again, I'm going to also count it from when we start the test. So say they come in the hospital, a lot of times I'll give them like 10, 15 minutes to just kind of calm down and adjust to being in the new environment before we get started too. So anything that happens, like, so they say they regurge the second they walk in, but we haven't even started anything. I'm not counting that as like after the exercise test that they did that, or like how the timing matches up.
Yeah,
Does that make sense?
that's a good yeah, it's a good explanation. And I think that it kind of goes hand in hand with when Heather was mentioning that people might be scared to test their dog because of like the nares.
Yeah.
This might be another thing that people are apprehensive about if they have a dog that would normally get really worked up just
Yep.
going to an appointment. So I think
Yeah.
it's valuable to
A
have your
drama dog.
input. Yeah,
Yes.
exactly. It's valuable to have that explanation so that they understand that even if your dog is acting like all wound up, it won't be the same type of sounds that you're hearing. So I think
Yeah.
that's a great explanation.
Yeah.
I also would say it's like the difference, if you've got an athlete that's a human, and they run, say the 200 meters, and they get done with it. They are breathing heavy. They are
Mhm,
panting. Like
mhm,
that is normal. That is part of exercise. But they recover, and they
mhm.
recover when they don't make all those sounds. So what I hear you describing, without having those videos to hear it, but it's like I'm not going to hear somebody that's doing what I do when I try and sprint now, and I get that lung thing where I'm going,
Yep.
that's because I'm just made my dogs bark, but I'm out of shape. I'm not fit. And I've just really stressed out my lungs past my fitness level, So I would expect that you would, it's normal to hear a dog have a physical reaction and a breathing from an effort, but it shouldn't, the breathing sounds should match what they just did, not be out. They shouldn't be off, right?
Right. You're absolutely right. And the other thing too, talking about the exercise test, like at the end of the day, it's a 3 minute walk. So it's not meant to be like a physical fitness test, right? Like a dog can
And
be
it's
out of
not
shape and still be
humid.
a grade zero.
Yeah,
Um,
it's not humid. It's
so
not the sunshine. It's not
exactly,
under.
exactly.
Yeah.
So even if they are completely out of shape, if there's not going to be airway noise, there's not going to be airway noise. It doesn't matter like their fitness level. It's literally just listening to how much work does it take to breathe in. So all really good points. And I could see those being concerns of like, well, what if my dog's overweight? Are they just going to score high because they're out of shape? But what we're listening for can't be reproduced with anxiety or just lack of physical fitness. I mean, you think about how many like what fat bugles come in the door on a regular basis, and we still don't hear those same sounds. So it's a very specific thing that we're listening for that can't be falsely there by being out of shape or anxious or anything else.
And one more question, because you've been talking about the stethoscope. I know when we did this test in Portland, they were using the Littman
Mhm.
stethoscope, the digital. Is that what you use normally, or are you using just regular stethoscopes now, or?
So I don't use a digital. The digital is so that they can record it for teaching purposes. So I don't
Um,
personally have a digital. And most vets don't have a digital. Which the benefit of the digital is that you can hear what I'm hearing, but at the same time, even playing the videos which didn't play, the noises that you hear in a one are so subtle that like I feel like half the time I'm convincing people their sound. So it's not always, it doesn't necessarily change things whether you hear it or not. Like from a digital standpoint, all of the I feel like most vets have a Littman. I have the Littman. I don't really know what the other main
I have one.
yeah, yeah. And they tend to like they're gonna pick it up regardless.
And heart murmurs, they can detect that.
Yes, yes. And it can depend on the type of stethoscope and the experience of the person to pick up the subtle heart murmur and subtle noises from this test. That's why veterinarians have to be certified because
Right.
it can be subtle. And if somebody's not trained what they're listening to, they could say it's normal, except it's actually a grade one or, something like that. And so that's why we have to do the certification clinic as veterinarians so that we know what we're listening for in the first place as well.
Mhm.
So let's talk a little bit about applying. So this is the matrix that OFA put together in terms of applying and um, making breeding recommendations from a score. So the thought with this table is this is your dog, and so we're going to say this is the female and this is the stud, just freeze. It can be either, it doesn't matter, but just so that I can kind of point out. So say you have a grade zero girl and you're trying to pick a stud. Grade threes are recommended not to breed regardless. So the grade threes are going to be out regardless, not to have anything to do with the girl. But the thought is that we want to decrease the severity and the prevalence of BOAS in the kennel or in your breeding program, and eventually long term in the breed. So I always call your zeros like your Swiss Army knives because these dogs can be bred with anybody; they're going to do great. they're going to help bring down your twos, or bring down meaning that future generations would hopefully be a one or a zero with time, but they're going to help improve the scores of whoever they're paired with. Your grade ones are still really steady. They can be paired with anyone. Again, the grade three is more of a commentary on the grade three than the grade ones themselves. The grade twos are where there's a little bit of gray zone because the concern is because functionally, a grade two is the highest grade that you are breeding, right? So while you have a grade three, if those dogs are not in the gene pool, your grade twos become your next most severe BOAS dogs. And so the concern with breeding a grade two to a grade two is that's your highest risk with your highest risk. And so in theory, they're going to produce the highest risk of having BOAS. So the recommendation is to use caution. I would argue probably avoid, but use caution with breeding a grade two to a grade two. But you can pair a two with a one or a zero to try to bring down those scores. And then your grade threes, again, a little bit easy, although difficult from a breeder standpoint sometimes. But your grade threes are just ruled out and automatically out of the gene pool based on the testing. So let's talk a little bit about finding a vet. Then I'll answer a couple kind of common questions that I hear, and then we'll go from there. So on the OFA website, if you go under diseases and respiratory function grading system, it has vets by state. Now, you'll notice there really aren't that many, which I know is one of the big issues at the moment. So this group of five we're all at the same hospital. So I know it says I'm Animal Hospital on South Main. We just opened a sister hospital in October. So it's still us. It's just our second location. We have five. We had a certification clinic at our hospital and all got certified together. But if you look at hospitals in the entire state of North Carolina, you have 1, 2, 3, 4, 5. Dr. Barber is retired. So you have 5 in the entire state. So I recognize that this is a hurdle as well. This testing system was first introduced to me and to there's a group called the Society for Theriogenology, which is the reproductive veterinary community. They have a conference every July. Hence, just when you were saying the clinic in July, and I'm like, well, I may be gone. It's for that conference. But they first rolled this out to us at that conference in 2024. Since then, so we reached out to Eddie Zook at OFA, and he helped us coordinate getting certified. And so if your vet does want to get certified, they can reach out to me or Eddie to kind of talk about what that process is. But the Society for Theriogenology conference this summer is going to have another certification clinic. So ours was at our hospital, like we lined up our own, but they're going to try to get through a bunch of vets in that certification day, basically, so that a number of the vets at that clinic or at that conference, if they're not already certified, can get certified. So they are trying to make efforts to increase the pool of veterinarians. Obviously, it's a process. It takes time for there to be demand for it. It takes time for there to be, the same awareness in the breed club and getting breeders to test. It takes the same amount of awareness and vets to get certified in the first place as well. Of all the OFA tests that we do, I mean, we have a lot of Frenchie breeders, but of all the OFA testing that we do, I'll say this is probably the least requested one. Because again, I think a lot of people, when I've had conversations, a lot of people tell me they don't want to know. So I know it's a partnership of us trying to educate and help advocate for the testing. And I know on y'all's end as well, explaining and advocating for this as well, because at the end of the day, we all want the same thing. We just want healthy dogs that are thriving.
I think a lot of it too is this fear of that, okay, my dog gets rated a 2. I have to not breed her. And they don't realize the recommendation is to go with the 0s and the 1s. And I was watching Dr. Ladlow's explanation about it. And she says, listen, if these dogs have a lot of other great characteristics, maybe they've got great hips, clear spine, whatever, temperament, all those wonderful things, you don't necessarily have to say you're out because you were rated a 2. You have another option. And I don't think that the awareness is out there for people to understand that it's not a hard stop. And at least not now. Maybe
Yeah.
as we get more evolved and we get it narrowed down, but they were very clear about that it's a tool, not a hard filter. And I
Correct.
think that's one of the messages that is misunderstood, and probably one of the things that we as a group can maybe help educate people with.
Yeah. I get that. And honestly, I get that with all breeds, not just with Frenchies, but I get that with all breeds that they view OFA or they view health testing in general as a pass fail. Like if the dog fails, it's automatically thrown out. And I'll come back to that point here in a minute because that is absolutely not the case. Again, I am adamant that there is no perfect dog. I think my dog is perfect. But even for her, her hips are actually well above average for the breed. So, again, there's so many decisions that go into this. There is no such thing as a perfect dog. You can't take one test and use that to make every decision because it's not that simple.
There's the perfect dog for you.
Yes. Yes. I mean, my dog is perfect for me. She's just also a mess. So one of the other common questions I get is cost. So I took a screenshot from one of our treatment plans. Obviously, every hospital is going to be different, and obviously prices change. So I'm not going to say that if you view this 10 years down the road that you can hold this and say, well, it was this. But we have the exam, the test itself, which is like what, $39. The camera is blocking it, $39, and then like the processing paperwork, which is like 20. So all in, the test itself runs like 138. I totally get cost. I totally get real world. Compared to CT, sedated testing, scoping, some of those other things that would be definitive for that particular thing. Comparatively, this is a very cost-effective test to do. And then obviously I know with health clinics at shows, often it's a lot cheaper because it's just that volume that ends up kind of helping discount a little bit as well. So at least just kind of has some of that. And then Heather, coming back to your point, there is no such thing as a perfect dog. At the end of the day, we're talking about BOAS, but it's just a piece of the puzzle. We're still talking about allergies, eye issues, IBDD, GI issues, reproductive issues, hip dysplasia, like other things within the breed. And so, well, yes, your grade threes may be a somewhat cut and dried decision that, if they're passing out doing a daily function, okay, they probably shouldn't be bred. It's a piece of the puzzle, and you have to look at the whole puzzle and not just one test result. And this is where, your breed mentors, using the breed club, using a reproductive veterinarian, like we're trained in genetic counseling, helping to try to find pairs that are going to help improve. It's not as simple as a one test, pass, fail, in or out. It's how does the whole puzzle fit together? What are the strengths and weaknesses of each dog, and how can we pair them in a complementary way so that we're working towards improvement, not oh, we didn't pass, you're just out. It's not that simple. And we're going to create a genetic bottleneck if we do that, because we do have to prioritize the overall health of the breed. And well, yes, breathing is really important. And obviously your grade threes shouldn't be bred. It's not just one component. So in terms of kind of everything from here, BOAS is a problem with Frenchies and many other breeds. We know that. This testing scheme is really accurate and it's non-invasive. So comparatively, this is a great way to get that information in a relatively simple, albeit not necessarily the most available testing path. The only way we can improve the breed is to test. So my number one recommendation is just test. Again, it's not the dog's going to fail, we're out, but you don't know what you don't know. And it can be really hard to differentiate a 0 and a 1. And so you don't necessarily know like the risk that your dog is carrying just on a day-to-day basis without doing the scheme. And then making breeding decisions with the matrix will help reduce the prevalence and severity of BOAS. Again, there's a whole bigger picture, but at least with BOAS, we know that in Europe, this has worked dramatically in improving respiratory scores within the breed. And we're hoping that as it becomes more prevalent in the US, we'll be able to do a similar thing here. Any other questions? That's a German short hair pointer, whoever asked. That was her 4 years ago, but